Survive in 5. Useful survival theory, information, and product reviews, all in 5 minutes or less. Brought to you by SafePrep. So in September of 2019, the Global Preparedness Monitoring Board, which is an arm of the World Health Organization, stated in a report that there is a very real threat of a highly lethal pandemic killing 50 to 80 million people. So now that we've scared you to death, let's talk about the coronavirus. So what is novel coronavirus? So novel means new, means that we have not seen this strain before, so nobody is immune to it, therefore it can spread easier. Coronavirus is a strain of viruses that can cause illness and up to including death in humans and animals. SARS and the Middle East respiratory syndrome are strains of the coronavirus. Who is most at risk? So as with most pandemics, healthcare workers, the elderly, children under 5, and those with compromised immune systems. So general symptoms include cough, fever, runny nose, and respiratory infection. So let's talk about the official numbers. So as of late last week, January 30-ish, cases worldwide, 11,889, with 17,988 suspected cases and 259 deaths. Now those were official Chinese government numbers figured into that, so the actual counts could be much higher. Now let's put some of these numbers into perspective for you. So in the U.S. annually, every single year, 30,000 people die from the flu. During the last SARS outbreak, 8,000 people became infected and 800 of them died from it. So that just puts the current situation in perspective compared to some past situations. So let's start with some news from some reputable sources, some government sources, and a word about official and reputable government sources. So it is the government agencies are charged with keeping societal order and keeping the public calm. So in order to do that and maintain that social order, they may actually downplay the severity of the pandemic or the seriousness of the threat. Just food for thought. When it comes to news organizations, they may amplify or over-exaggerate the effect that the pandemic is having just to get viewership and ratings. So we can't believe anything we're told. Some official statements this past week. Right now, there is no spread of this virus in our communities or at home. That was an official statement from the director of the Centers for Disease Control and Prevention. More cases are likely to be identified in the coming days, including more cases in the United States. It's also likely that person-to-person spread will continue to occur. There has been one case in the United States of person-to-person spread, and that was a spouse who caught it from their significant other. So the risk to individuals right now is exposure based. So if you're not exposed to it, if you're not traveling to China, if you haven't been around somebody that's got it, then you really don't have a chance of getting it, luckily. So the immediate health risk from this virus so far is low. The goal of the U.S. response to this is basically to prevent sustained spread of the coronavirus throughout our country. Americans should know that this is a potentially very serious public health threat, but at this point, Americans should not worry for their own safety. And that came directly from the Secretary of Health and Human Services last week. So this is a very quickly changing situation, as are most pandemics and contagions. We will keep you updated. We'll keep the numbers updated. And remember to take this opportunity to get your family prepared for whatever the emergency is. If you stay tuned after the video, we'll tell you what SafePrep is all about and how we can help your family. Until then, y'all, be prepared. Hey everybody, this is Justin with SafePrep. We provide individualized emergency preparedness plans and equipment recommendations and training specifically designed to meet a family or an individual's specific needs. There is information on preparedness in most communities, and there is a wealth of information all over the internet. Some of it can be contradictory, out of date, and you really have to be able to sort through all that, and it takes time to be able to see what applies to you and your situation. With over 20 years working in emergency services, I work with you to evaluate your risk and to come up with the best plan for you and your family. I'll walk you through a step-by-step process that evaluates those risks and exposures, and we identify immediate steps to correct those and get you prepared for disaster. Most importantly, you will have the peace of mind knowing that you have done everything that you can to best prepare your family for what may come in the future. So please visit our website at SafePrep10.com. Be sure you like and subscribe and hit the notification icon on our YouTube videos. You can also find us over on Facebook. Until then, next time, y'all be prepared.